Amidst the global pandemic, try to visualize the situation wherein people, especially the students and workers, have to report to their respective places with no COVID vaccine or immunization. What would you feel? Scary, right? It is really a risky and perilous situation. Lawmakers, government officials, business owners, school presidents, parents, and even students are currently discussing a debate on how to combat this issue. They have been conducting several surveys on whether to push through face-to-face interaction with or without vaccine. Vaccination is a human right. However, many companies have required their employees and students to get vaccinated for compliance. The question is, should we get our kids vaccinated in order to attend the face-to-face classes? First and foremost, vaccines ensure effectiveness and the reduction of the COVID-19 transmission. Children ages 5 to 17 are the most vulnerable ones with this type of virus. Children also make up a significant part of the population, so they are at high risk in spreading the virus in a face-to-face environment being unvaccinated. With them being vaccinated, it can help lower the risk of more COVID-19 infections. It is beneficial for them to be inoculated with the vaccine since it can help them from being severely ill even if they get the virus. Being vaccinated means having resistance from the virus. In addition, vaccines are safe. Millions of people around the world have received COVID-19 vaccines since they were authorized for emergency use by FDA. A growing body of evidence has shown that these vaccines are safe and effective. COVID-19 vaccines were developed using scientific methods that have been around for decades. Before recommending COVID-19 vaccination to children, scientists conducted clinical trials. The FDA gave the Pfizer-BioNTech COVID-19 vaccine authorization to use in children aged 5 to 15 years old and full approval to use in people aged 16 years old and older. This just shows that vaccines are well developed and under observation before they inject them to the children. Moreover, people can start doing more after being fully vaccinated. After children and adults are fully inoculated with the vaccine, they can resume many activities that they did before the pandemic. Take the face-to-face classes, for example. CDC recommends that fully vaccinated people must wear a face mask in public indoor settings if they are in an area of substantial or high transmission. Students must wear face masks inside and outside of the school premises. However, the opposing view is that not everyone agrees with the vaccination. Concerned parents are opting to forego vaccinations for their children for many different reasons. Others may believe that the vaccination may cause you potential harm. Others have their own testimonies about the negative effects of the vaccine. Anti-vaccination sentiment isn't new. There have been people who have objected to vaccines as long as there have been immunizations. To summarize, I sincerely believe that we should get our kids vaccinated for face-to-face classes. It's for the safety and welfare for all. It is the most cost-effective way to improve your health and immunity. You may be a hero and disrupt the COVID-19 transmission cycle by exercising physical distancing and getting vaccinated. It is customary and necessary to require children to get vaccinated before entering school in order to promote a healthy learning environment. We should take advantage of this opportunity to defend ourselves now that we have the vaccination and it is available for free. The vaccine has several benefits for us, our families, and society as a whole. In this speech, I can say that the advantages of vaccination really outweighs the negative ones. Our fears will be addressed if we all agree that pupils must be vaccinated. We will know that the environment we are entering into is safer than before. After all, there's nothing we can do now that we have advanced technology to fail.